guys, it's Nicole from the Physio Crew, and I've had a cancellation today at the Hydrotherapy at Abbots Leigh, so I thought I'd bring you a quick training video on what causes numbness in the arm. So there was a lady today who was in one of the classes, and she's been getting this numbness in her arm, so it just prompted me to think that there's a lot of kind of false beliefs about what causes numbness. Now, yes, if you get tingling and numbness and pain in your left arm, that can sometimes be related to heart problems, but that's very, very uncommon. So if you're worried that you've got a heart problem, if it's that you're worried that you're having a heart attack, obviously you would call 999. But if you're just got a few questions about maybe some tingling in the arm, or you can always call 111, which is the NHS support line, or you can call your local GP as well. But for most people, they're experiencing numbness that it's come on maybe what we call insidious in onset, so it's just come on over time, or some people will experience it after an injury. So if you've had something like you've fallen from height, or you've hit your head and you're getting numbness, if you're getting in both arms, we would be concerned about that. So we would say not to move you if you're getting tingling or numbness in both of your arms. If you're watching this video because you've got a loved one and you've just googled numbness in the arm, if you're getting it on both sides, don't move that person. Call 999, and especially if they've fallen from height or they've hit their head quite badly, just keep them still, don't move them, and speak to the relevant people. If you are the sort of person who is getting numbness following maybe a change in your seating posture at work, or perhaps it's just come on since you've changed your chair at work, then these sort of things can often be nerve root irritation. So different areas that cause numbness is you can either get numbness because there's a problem with the nerve at the site where it's coming out. So that is either side of the spinal column, you're going to get a nerve coming out either side of there. And as we get older, we lose water content in those discs. So the little hole, I'm trying to show you there, the little hole that the nerve comes through gets slightly smaller, and that can sometimes cause nerve numbness in the arm. So the nerve itself, I always describe it a little bit like a hose pipe. So the water trickling through the hose pipe is like the nerve conduction, so that's the actual signal itself. And what often happens is, if you imagine that you kink the hose pipe, the water sort of trickles down. That's what I describe as sort of pins and needles. And then when it's actually been trapped completely, that's normally either numbness, or if it's been like that for a long time, actually it can then become painful. So what we're always trying to do with physio is work out, is it entrapped at the site, i.e. where it's coming out, the nerve root itself? Is it entrapped because of swelling around that area? So there's a little something called a facet joint, which is where the two bones of each vertebrae meet. And that can sometimes get irritated, and if you've got swelling, it's actually the swelling that pinches the nerve, as it were, because it causes pressure around the nerve. So that can be one reason. You can get numbness because of a peripheral irritation. So there's lots of tests that we can do, but clinically what they would do is something called a nerve conduction study to look at whether the peripheral nerve, so that's anything away from the spinal cord, whether that's working efficiently. Nerves can be damaged in that respect from things like car accidents or work-related accidents, but you need sort of significant trauma. That's not the sort of thing that really develops over time. You can get nerve entrapment around the elbow as well, so that can give you numbness lower down in the arm. But what's really clever about the body is there's lots of things that tell us why which area is affected. So for example, you've got things like dermatomes. So dermatomes are the area of skin that's innervated. So if someone comes in and says to me, right, I've got numbness in this area of my arm, I get it when I do this and this. So for example, let's use an example. So if they're getting pain when they look up, and then when they look up and to the right, and then they're getting pain in the C6 dermatome. So the C6 is a level in your neck, and we know that a certain area of the skin is innervated. So if you're getting numbness in that particular region, what I would be saying is, okay, so the symptom fits, the aggravating factor fits, so therefore the most likely diagnosis is this. We then do a test retest. So what that is you do some exercises and some treatment, and then you look again and you see whether it's changed. So one example of that, he didn't have numbness, but there was a boy that I met at the yard. I do a lot of treating just as I walk around. In fact, I treated earlier one of the girls at Freeways. I actually don't work for Freeways at all, but the manager was like, oh, she's hurt back, do you want to go in and help? So I was just in the office, just getting her to do her her movements, and we managed to get rid of her pain in, it took me 5 minutes. And the same with this chappie. Both of these were quite straightforward muscle problems, but this young lad, I saw him at the stables, he had an injury where he had an extension injury to the opposite side. Now, because of the position of his neck, I actually, when I was listening to his mechanism of injury, it made me think that actually maybe he had irritated the facet joint, he'd extended and then he'd got inflammation around the nerve, and then that was what was causing the pain. But when I looked at him a bit more closely, he wasn't getting pain when I, sorry, it's the opposite way, when I was loading the facet joint. He was getting pain into extension, which could have been facet joint, but then he was okay when he was flexing towards the side, which you wouldn't expect. So what I did with him is I got him to look over the left and the right, and he couldn't look over the left side to begin with. He had an extension injury to the right, but he couldn't look to the left. And so what I did is I said, right, okay, just lift your shoulder up and then look. And he could go a little bit further, but not completely round. So that doesn't tell me completely whether it's the muscle or the facet joint. So I had to do a couple of extra tests to look. And I said to him, right, we're going to do some test retest. He's a horse rider, so I knew he's a bit of a tough cookie, so I was like, right, okay, I'm going to be a bit aggressive. It's going to be a bit painful. The pain isn't because you're getting damaged. I'm not damaging you by touching your muscle. What's happening is the tissue is sensitized, so we're just going to have to be a little bit mean for a couple of minutes, and then it will relieve it. And he was like, yeah, that's absolutely fine. So got my consent, and then so what I did is a trigger point release first of all with a combined rotation to the opposite side, because we don't want to go to the same side because we haven't ruled out facet yet. I knew it wasn't a facet joint at the end of the treatment because I got rid of his pain. If it had been a facet joint, that wouldn't have happened. It would have taken a little bit longer for his pain to settle. So I knew that the driver was actually the muscle. So I did that one, pain improved. He was able to look over to the side, but he still wasn't able to do extension. Now at that point I had the choice to either do a mobilization or actually to do some more soft tissue release. Now I did some more soft tissue release because of the mechanism, because he had extended through his scalenes and his sternocleidomastoid, which are the muscles at the front. I knew that those muscles had probably been overstretched. So we did a contract relax over to the opposite side of his pain. That helped to ease his symptoms. We then did a levator scap stretch, which is down to the front. That relieved his symptoms. So with contract relax, it's a muscle energy technique that we do, because sometimes if you just stretch but you don't do a contract relax, sometimes it's not enough. So it's just what's really important. What the difficulty of physio is knowing what is the right thing to do at the right time. What's going to irritate the structure? What is not likely to irritate the structure? And we do it in a very systematic way, so that we minimise you guys getting any pain. That's the whole idea, isn't it? Is we want you to come in and go out feeling amazing. Now, I'm not saying we do that every single time, because, you know, we're not magicians. We are just working through a system and a process and trying to treat each patient very individually and spending time listening to what you're telling us. So many of the patients that come in for second opinions with me, they say the difference that I've had with you is you've actually sat there and listened to me like as a person. I haven't felt so often with like consultants and ESPs, extended scope practitioners, they just go in and they just get nailed with a load of questions, but no one listens to their story and what their dreams are, what they want to get back to. You know, there's no point pushing someone to be able to run 100 meters at full speed if they never intend to run ever again. They probably care more about being able to get on and off the floor because actually they enjoy doing a bit of yoga, or you know, it's very important that we base the treatment for the person. And so I've gone very off track now, guys, with this numbness. So I was talking about numbness, so causes of numbness. So that guy, anyway, that young man, he like I said, he didn't have any numbness, but he was able to go from not being able to move his neck to within 10-minute treatment being able to completely rotate round, no problem, no pain, completely gone. So the difference with someone like him and someone who's got numbness is likely to be slightly more sensitive because the nerve could be involved. So we wouldn't be doing aggressive stretches like I was showing you with that young man. That's why I was using him as an example. We would be much more likely to be looking at doing gentle nerve glides, like I said, trying to determine whether it is a peripheral, whether it is from the central. So is it being affected at the site where it's coming out from the spine? Is it being affected as it goes through the thoracic outlet? Is it being affected by tight muscles around that area? Is it actually further down the system? So it's really, really important. Hi, Stuart. So it's really, really important that you're trying to distinguish exactly where the numbness is coming from and actually treating specifically for that one. So what I would advise that you do, if you think that you've got numbness in your arm, if it's not in both sides and you're wondering whether it's something that physio can treat, hopefully my training has explained that we're quite knowledgeable on nerves, and we all of the people at the Physio Crew are really high quality staff. They've all got degrees. We have a really, really good CPD system. We try and encourage people to really push outside of their comfort zone to develop themselves, and been amazing. We've only actually been based in Bristol, I think it's for like 3 or 4 years now, and Abby and Lucy have just come on leaps and bounds in their development. Meg is 9 years qualified. She's doing really, really well, and she's getting really involved in sort of pushing the service and expanding so that we can help more people. Stuart has completed his physiotherapy degree, which is absolutely awesome, so we can't wait for him to start seeing some physio clients as well. He's been working for us for a while with the massage side, which is just absolutely fantastic. So if you have an injury and you're not sure and you need an expert and a professional to look at it, you need to just take that step. Like I understand that it's frightening when you haven't been in to see a professional before, but we will take really, really good care of you. We are very, very different from other physios in the area. We will put you first in every situation, and we will actually use our minds to find out what's going on. There's so many physios in the area that are just dinosaurs, that just, you come in and they just churn you out, and you don't get that personal service. But if you come to the Physio Crew, you know you're going to get that personal service. You know that we're going to put you first and look after you, and use nice evidence-based treatments to get you better. So if that's something that sounds interesting to you, pop onto our website, learn a little bit more about us. We've got a really convenient online booking tool. It's really easy to use. Just www.thephysiocrew.co.uk, far right hand side of the menu bar. Pop your details in, or if you prefer the old-fashioned way, that's fine as well. Our number is 0117 290 0242, and and just ask me questions. I'm going to be doing lots and lots of training every time that I have a cancellation. I'm going to be doing training, so I'll try and deliver loads and loads of value so that you can keep seeing that we give more than other people, and we want to continue helping people across the southwest, across the UK, and I hope that you can be part of that. All right then, guys, take care. Bye bye.